I'm Dr. Odoye, and today I'll be talking about precision medicine, ancestry, and Alzheimer's disease. Imagine watching your loved one fade as Alzheimer's disease slowly rips them away. And imagine being unable to do anything about it. I watched my granddad suffer and die to Alzheimer's disease. And the lack of understanding for this cruel disease inspired my PhD thesis. Alzheimer's disease, or AD, is a neurodegenerative disorder that primarily affects older individuals, leading to memory loss and ultimately death. And AD affects more than 6 million people in the US and costs the nation an annual $305 billion in treatment costs and lost labor. Because of its complexity, there are no simple treatments that work for most patients. Our current understanding of AD and its risk factors remains incomplete, and to date, there are exactly 0 effective interventions for this disease, leaving all of those affected with no options for treatment. My thesis focuses on the genetic aspect of AD, specifically the gene apolipoprotein E, or ApoE, the single most significant risk factor for this disease in most people. And ApoE is responsible for up to 20% of AD risk. In other words, by studying this one gene, up to 1 in 5 AD patients could see improvement and even a cure for their disease. Importantly, that 20% of explained ApoE risk was seen in people of European ancestry. Recent studies show that, depending on one's continental origin, ApoE risk actually differs, though we don't know how differences in continental origin contribute to the stark variation in AD risk. And without that understanding, we cannot create effective, targeted therapies to save lives. My thesis utilizes biostatistical approaches to precisely identify these differences in multiple ancestry groups. In the first and largest project of its kind, we seek to isolate specific pathways that modify AD risk and understand how genetics, ancestry, and race all come together to influence AD risk. In summary, this work lays the foundation for targeted drug therapy that decreases AD risk, generates personalized treatments, and achieves optimized interventions for all people affected by Alzheimer's disease. Thank you.